So shortly after the doses of Pfizer vaccine were first administered, we saw that happen overseas in the UK, we heard those reports coming out, people starting to have allergic reactions. So here in the US, there was that healthcare worker in Alaska that was hospitalized after getting a shot. But a key COVID-19 advisor for President-elect Joe Biden says an allergic reaction is really a small price to pay for protection against COVID-19. So I guess, Dr. Nachman, let's start with you. Do the pros outweigh the cons for this?
So I think each person has to make a decision whether they feel that they should get the vaccine. We're not mandating anyone get the vaccine. But when we think about the big picture, who had those allergic reactions, how long did they last, what happened? We've seen both two patients in Alaska and two in the UK having those reactions, and all of them are totally fine 2 days later. So I think, yes, it is a concern. Yes, wherever you're getting your vaccine should be prepared in case you or anyone else has an allergic reaction. But the long-term downstream of those reactions has been absolutely nothing. And when I think about the COVID cases that we're seeing in the hospital, how many are sick, how many in the ICU, I think every person has to make the decision for themselves.
All right, and Rachel, what was that like for you? Were you nervous about, potential side effects?
No, I wasn't. I think because I've done several vaccine studies in the past, I wasn't. I very much trust the science and the scientists behind it. So I wasn't nervous, but also I did feel like a side effect from this was going to be better than getting COVID for sure. So that I didn't have concerns really.